WHO calls COVID-19 the defining global health crisis in our time. And we've entered uncharted territory and to get a better sense of where we might be going over the next few months, and taking in terms of the impact on that on the most vulnerable among us. Claire from the Trottier Foundation, but also from McGill, professor of microbiology at McGill, has agreed to make a short presentation based on the latest data. So I'm gonna ask Claire to go ahead with the presentation. After each presentation, we're gonna ask one or two questions of the presenter and move to the next one. At the end of the hour, we'll open it up to a general Q&A to ask a question from any of the panelists. So on that note, Claire, take it over.
Great, thank you so much, Jean-Marc, for organizing this, and thanks to everybody for signing in to view this webinar today in these very intense times. So I'm going to start my presentation, which I'm not able to control. Jean-Marc, can you go to the next slide, please, or whoever? Perfect, thank you. I'm just going to start with a little bit about who I am and the various perspectives I bring to the table. So first of all, I'm an assistant professor of microbiology and immunology at McGill. My training is actually in virology, so I bring that expertise to the table. I also wear a number of different philanthropic hats. I'm the co-founder and chair of the board of Welcome Collective, which helps refugee claimants here in Montreal, very vulnerable population, right now having a very hard time accessing food banks. I'm on the board of the Trottier Family Foundation, a private foundation based here in Montreal, as well as co-vice chair of the MUHC Foundation, which is a teaching and research intensive hospital based here in Montreal. So I wear a number of different hats. That being said, I'm not a public health expert or an epidemiologist, and I'm going to be doing my best to bring you up to date as quickly as possible. Next slide, please. So by now, I think everybody is familiar with the idea that we need to be flattening this curve in order to ensure that the number of cases at any given time is low enough for health systems to be able to handle these cases. And that's why our governments, local and federal, have been very strongly urging various social distancing measures in order to flatten this curve, in order to preserve the capacity of our healthcare system, slow the spread of the virus, and save as many lives as possible. We can see some actual data from a case study on the right in Italy. So this is being borne out by the data. You can see comparison between two different cities in Italy, one, Lodi, that shut down quite early in the game, and one that waited much longer to shut down. And you can see the impact of that delayed shutdown on the number of cases. Next slide. In terms of the latest situation in Canada, this is the data as of last night, compiled by some graduate students at University of Toronto. We can see that Canada has managed to conduct a very significant number of tests. Testing capacity is increasing rapidly. We're seeing increased number of positive cases. Part of that is because of this increased testing capacity. Part of this is likely to continue increasing as we continue detecting more cases and as we start seeing community spread in a number of communities here in Canada. Next slide. So one of the key questions everyone's asking, how long is this going to last? There is absolutely no way to really tell at this point. What we do know is it took 3 months to contain the spread in China. We know the outbreak in the US, as an example, began March 1st. So one potential best case scenario is controlled spread by the end of June. That being said, most of the experts that I've spoken to seem to agree that we are potentially in this for a much longer period of time. Very difficult to predict how long and what that will look like. Next slide, please. There are three sort of categories of scenarios that we can consider. Scenario one is a scenario which is called a delayed outbreak, where social distancing measures keep things under control for now, but we may see a peak in the number of cases at a later date. Another option, scenario two, is the slow burn, where we may see sort of measures being relaxed and then reapplied over time in order to keep the curve as flat as possible for a slow burn of this infection. And then finally, 3 is when we're all hoping for some kind of medical miracle. Again, uncertain when that we can expect that. I know several people working on vaccines, various therapeutic solutions. Very hard to predict when we can expect anything on that front. Next slide. So, you know, the reason for social distancing is, as I explained before, and as you've no doubt seen in the media, and of course, the virus itself has bigger impacts in certain populations. At the same time, the social distancing measures that are currently being suggested and implemented also have impacts themselves on a number of key groups who are in very vulnerable situations and who will continue to be in these situations as long as these social distancing measures are in place. And so this is an area, I think, where as a community of foundations, we should be looking at how we can support food banks, other organizations that support these vulnerable populations. In addition to that, you know, one of the pieces of good news we've seen is this movement of what's called care mongering here in Canada, of everyday citizens sort of raising their hand and saying, you know what, I can deliver some groceries for my neighbor. And there are lots of organizations, you know, sort of cropping up on Facebook, people trying to get organized. I think these groups are going to need some kind of support in order to make them sustainable and safe in the short, medium, and long term. Next slide, please. And then the final piece really, I think, is the impact on our various health systems, care facilities, which are under a huge amount of pressure right now and are likely to require support. I can tell you that the scientific community is mobilizing in ways I'm so proud. Last night, our chair sent an email out asking researchers to donate reagents for testing. So we really see the scientific community stepping up to the plate. A lot of my colleagues are working on vaccines and therapies, and everybody is going to also need support on that front. Last slide is just acknowledgments to thank some of my colleagues for advising me on this presentation, and thank you all for listening to my very rapid presentation. Thank you. Jean-Marc, you're on mute.
Yeah. Merci Claire pour cette présentation and to do so in record time. So I do have one question for you that came through, and it goes like this. So amid growing concern about COVID-19, we are seeking opportunities to help physicians, other healthcare professionals, as well as vulnerable and marginalized population. Have there been any discussion on this issue? Would very much appreciate the opportunity to discuss and learn about what the philanthropic sector is hearing and doing, and whether there's an opportunity to support and or amplify.
I can only speak for myself at our foundation. You know, I think we're having a meeting this week to try to have an initial conversation on what we can do to mobilize in the short term. And I think that all foundations should be thinking about how we can mobilize resources in an unprecedented way in a very short time frame. I know that some groups have made commitments, though not public yet, for certain organizations to help in this effort. So I believe the philanthropic community is mobilizing, but maybe some of the other members on the panel here could offer some insights as well on that point.
Merci. And for those who joined the call later, just a reminder that we'll make the whole webinar available online, and be sharing the presentation that way. On that note, I'd like to move to our next presenter on the panel, Conrad Sauvé, President and CEO of the Canadian Red Cross. And the Canadian Red Cross has been on the front line of this from day one. So I'm so glad that Conrad could find some time to join us on the call today. So Conrad, over to you.
Merci, Jean-Marc. Thank you for the opportunity to participate today. And I'm going to do, again, a short presentation. I'm going to try to build on some of what Claire said as well. in terms of the Red Cross experience. Just briefly as a presentation, I've been the president and CEO of the Canadian Red Cross. 70% of our operations are domestic and been heavily involved in emergency response and the increased scale of emergency response in the last few years, and of course 30% international. And on this operation, we've pulled, and I'll share with you some of our international expertise. We had responded massively to the Ebola crisis years ago, so we pulled part of that team here together. So if we go through the slides, a bit on the immediate term, I'm going to go fairly fast on some recent operations. I'm not seeing the slides change. There we go. All right, we can go to the next slide. So very fast, we've been supporting the global response in the early, supporting some of the China operations, and we were active in Japan, supporting Canadians that were there. If we go to the next slide, we deployed part of our international and domestic team to help with the quarantine of the some 700 Canadians at Trenton and at NAV Canada. And I'm mentioning this, where we developed an expertise in working with PHAC, we deployed some of our global health doctors in looking at the protective, how we can work and protecting both those we serve and our staff in these situations. I think this is going to be a discussion as we go forward as well that's going to be quite important. So we deployed part of our field hospital to Trenton. We have two 80-bed field hospitals actually that are where we're working with PHAC on where they're going to be most needed, and looking at, again, with the government, what's the baseline of all of our inventory right now to respond. If we go to the next slide, I think one of the important aspects, and I've been in conversation with some of the leads of some of the top charities in the country, is our shared challenges as a sector. The nonprofit sector is an important sector also of the Canadian economy. And I think there's an opportunity in terms of an advocacy. There's going to be a lot of government support coming. And so, of course, organizations that operate will have loss of funding, loss of fundraising money, loss of revenue. So will there be a federal package for the nonprofit sector? So I think it's an important aspect in terms of us working together. We've reached out to federal finance on that, and there's an openness to look at that, as well as other potential policy issues with CRA that we could address more specifically. I think one of the biggest challenges, and really I appreciate Claire looking at the timeline on this, is there's a lot of conversation, of course, on immediate needs, and we're starting to see the packages that the federal government and the provincial governments are rolling out to support people. So I'll give you one example. We are working with Quebec right now, whose Quebec government has released $100 million to support 65,000 people that are vulnerable financially. So we will be administering that. We're working with another province and looking at the same type of program. So there's a whole series of measures that are going to put in place. We don't quite see the whole extent of that. So I think we need to make sure we're not, as on the charitable sector, duplicating what could be coming and understanding where some of the gaps are. One of the important areas, again, and I'm going again on, I think I'm not going to repeat the vulnerable groups that Claire mentioned. I think they're absolutely right on. I think one of the biggest issues as we look at those that are facing, wherever you have a direct contact with somebody you're helping, we know that the chances are, of course, that the virus will spread quite a bit, will make more people infected. And so the requirements around when you need to wear protective equipment, the availability of that protective equipment, the training around that whole side is going to be very critical. Otherwise, people will refuse rightfully to put themselves in harm's way, or if they do, could in fact spread the virus. So I think the whole aspect of protective equipment, we've raised this with the federal government, who's going to manage the stockpile, who's going to train organizations, and we're getting calls at different points of saying, will we manage the Red Cross, an additional shelter for homeless people who get sick? And of course, we do not have the resources to do this across the board. So again, how do we make sure that people can play their role safely. I think this is one of the big issues. So again, opportunity in terms of advocacy, and again, we have to look collectively, how do we better equip those? And I think it's the same issue as if you're going to help your neighbors and all that. The direct contact issue is going to be, of course, protecting yourself and protecting others is going to come front and center. If we go to the next slide. Now, the effects, of course, are unknown and likely to be long-term. So again, we're speaking to foundations here. Again, there's some immediate needs, how we work that. I've mentioned that, and we have to look at that. We have to look at what's the pacing of this. And in the Red Cross world, of course, we're concerned that we're heading into disaster season. It's been the last 3 years we have taken care, supported over 260,000 Canadians evacuated for floods, fires, mainly tornadoes. So how are we going to manage these evacuations, and how do we prepare for that in the context of this virus being present? So how are we going to adapt our services? So there's a need, again, for some immediate, there's a need for looking ahead, and there's a bit of a pacing on all this. Because again, as Claire mentioned, we're not sure how long this is going on, and we have to pace ourselves in addressing immediate needs, but start looking at also the long-term, midterm and long-term needs as well. I think I have one more slide. That's it. No, I think I covered my points. Thank you, Jean-Marc.
Merci beaucoup, Conrad. We have received one question about this issue of coordination and duplication, and what do you see at a national level as the best mechanism to be able to share information amongst the community and avoid having that example is not a question, but avoid having 20 organizations buying protection equipment, for example.
Well, I think there's different areas there, but certainly in terms of protective equipment, the federal government will be. I think the governments have a role in terms of the purchasing, certainly in a period where there's not excess offering, and both federal government and provincial governments in coordinating who has access to this equipment. Now, again, I'm really preoccupied with making sure we have training capacity in place. So we're engaging in this discussion. This is an opportunity to share. And again, we have a lot of experience in how to manage this, dealing with firsthand with the quarantine Canadians. So we're offering that. I think we need to get a sense also, and I raised this with the federal government and the provincial governments, we don't have a full picture of the whole aid packages that are going to be available. Direct support, cash support, alleviating payments, et cetera, et cetera. So understanding in that where the gaps are. We're getting a lot of calls to say we'd like the Red Cross to engage immediately in certain things. And we're just a little cautious to say, well, let's look at where the real gaps are, who's doing what, because there's going to be so much to do here. We don't want to duplicate. So I think there's some coordination nationally, some coordination provincially, a sense where governments are going, federal and provincial. It's not all set, but we're starting to see the size of the packages. And again, organizations on themselves, and I think we can do some good work collectively for that. You know, we will lose a large part of our revenue from activities we normally do. So what will be the support to our basic organizations as well? So that's an area, I think, of advocacy for us collectively with regards to the government.
Merci, Conrad. Well, we'll go back to a general Q&A at the end of all of the presentation. So I'm sorry to rush it through, but we want to leave a significant amount of time for the general Q&A at the end. So at this point, we've talked about, I apologize for that. We've talked about the kind of national response. I'd like to look at a kind of community response. Looking at the latest data, Vancouver is very much in the front line of being hit first by the COVID-19. So glad that Kevin McCord, the president and CEO of the Vancouver Foundation, is able to talk about what's happening in Vancouver, and how the philanthropic community is collaborating. Over to you, Kevin.
Merci beaucoup, Jean-Marc. I really did appreciate the opportunity to join this webinar today. And As you mentioned, Vancouver was an early, there's early evidence of COVID-19 here in Vancouver, largely as a result of our proximity and close relations with China and Washington State. So we've seen a gradual escalation of distancing, closures, patterns more or less the same across Canada, but perhaps started a little bit earlier here. As a community foundation, we were paying close attention to what the charities that we fund were doing. And we saw a very clear focus, initial focus of charities looking at their own staff, their own clients, their own events. And there was clear tension between, within charities, trying to manage this balance of doing everything necessary to follow public health advice, but also keeping their organizations running. And we saw, I think that is one of the tensions that charities have certainly faced, is getting this balance right between doing what's right to manage the epidemic, to flatten the curve, but also this clear tension that they face on keeping their organizations going and keeping their services running. So as a community foundation, we had to go through that kind of same transition. Are we okay? But then focus on what can we do for others. And that shift didn't happen as quickly as it would have in an organization that's used to doing emergency response. A community foundation like ours, traditionally a funder of longer term programs, not used to responding to emergencies, relying very much on the Red Cross or public health authorities to do that work. But there are two things that inspired us to get to shift from being concerned about business as usual to getting involved in the emergency response. One was the fact that we are an endowment-based grant maker. And our endowment, in fact, when we did our most recent assessment of the impact of the crisis on the endowment, mid last week, we were down by 8% in our responsible market funds. And in our fossil-free fund, we were down by only 6.4%. And it's an important thing to recognize as funders that the stock market is not our endowments. We have mortgages, we have real estate, we have alternatives, we have fixed income, and those are doing what they're supposed to do to a large measure. We are certainly down, but after an 11-year bull run, if endowment-based grant makers don't have the capacity to withstand an 8 or a 6 or a 10 or a 15% drop, then we've really squandered the opportunity these last 11 years have presented us. So that our endowment's in good shape. We're not anticipating being able to maintain our granting. So that gave us the confidence to make this shift into a proactive stance. And also, as some of you know, I spent 25 years working in international development work, responded to many crises around the world, and was able to assure my colleagues and board that there was a useful role that the foundation could play. So those two sources of confidence, my own experience as well as the health of our endowment, and also being inspired by what other community foundations have done in Seattle as one neighboring example. We created a response fund, a COVID-19 response fund at Vancouver Foundation with $1 million contribution, and then started talking to partners to see who could join us in that fund with the primary purpose of the fund being responding to the charitable sector in our region. And within moments, we had a Van City Community Foundation, Van City Credit Union, actually the credit union itself, the United Way of the Lower Mainland, and the City of Vancouver join us. And with a few other donors, we now have a $2.5 million fund that is essentially ready to go. And that fund is going to focus on I'll talk a bit about the methodology and then a bit about the purpose. The methodology is between United Way, the City, Vancouver Foundation, we know who is doing frontline response work in our community, and we're going to identify the agencies that we know are doing good work and give them money. There's not an application process to start. We're just going to go to agencies that we know through our own work and offer them funding because we know food banks is a great example. It's very clear that what they require. We know that. We don't need them to apply to us. We can offer them funding. And we're setting up our fund with three primary purposes. A significant one up front is just to provide information to address the fear and confusion using peer educators as an example. You know, many of us are probably on Twitter too much trying to get information, but there are a lot of people in vulnerable communities that do not have access to reliable, consistent public health information, and we want to make sure that that information is reaching the people that need to hear it. We will focus on the immediate needs, food, hygiene, basics. And we will address the impact of lost work and revenue in the sector. So we also expect that this fund at $2.5 million is only the beginning. We have yet to even publicly ask for further contributions. So we suspect we will get strong support. We have yet to talk to governments about whether they want to use this method, use this partnership. So we're anticipating that we will be able to provide some useful both coordination and resources to charities that are facing these challenges. We are starting with the Metro Vancouver region and the Fraser Valley, largely because of the expertise of the partners we have, but also that is the center of the outbreak at the moment. The Vancouver Coastal Health and Fraser Valley have by far the bulk of the cases, and so that, as well as the significant numbers of organizations. So we have plenty to do in this area, but we expect that we will expand across the province in due course. I'd also just mention a little bit about the members, why we think that this model is one that I would encourage others to look at and see if you can copy this in your own community. The combination of a financial institution such as Vancity, the United Way, a municipal government, and a community foundation, in our view and in our community, gives us 4 very unique perspectives on what's happening. It gives us the opportunity through the credit union to understand and possibly provide support to the private sector, to small businesses. Vancity, in the last crisis, financial crisis, 2008, 2009, created the Community Success Fund, and they specifically worked with the business sector in the region to support them. So we have insight into 4 key components of our community: the private sector, municipal sector, United Way, and the foundation sector. And we do hope that this will expand across the province. We can either encourage people to copy our model and have replicated in their community, or people can join our group and we can make a larger group and expand as more people join us. The last thing I would talk about, I'll just come back a bit to the endowment and some of the things that we're early discussions about what the role of endowments in the future. It clearly gave us the capacity to respond right now, but we're also watching closely to see, what happens to it. How long does this crisis last? How quickly do we bounce back? And how much of a cushion do we need to maintain? One of the key measures how we manage the foundation is managing the difference between contributed capital and market value. And we have a cushion, substantial cushion. This is one thing that I'm going to watch very closely, if we come through this with a large part of our cushion intact, it sends a signal that we've perhaps over-provisioned. And I would encourage every foundation that's doing that to look very closely at their endowment, the cushion they maintain, the inflation-protected margin you might be holding, and consider releasing that, portions of that, as we go into the recovery phase. Because as others have mentioned, this is going to have a long-standing impact on the charitable sector. We have resources we can release immediately to support the immediate responses, but we may be able to, and may be entirely justified in using some of our endowment as special distributions to the charities we fund, because ultimately the only purpose of a foundation endowment is to support the charitable sector. We need it to survive and come out of this on the other end, and if that means considering even unorthodox practices like increasing distributions, special distributions, if our endowments can withstand this financial crisis, I think it's incumbent upon all of us to look very closely at our reserves. And the last thing I would say is that there's a lot of conversations around the charitable sector asking for support, identifying the challenges we're facing. I think it's particularly important that we stand up and say, this is what we're doing, and then ask for support and indicate that we are a strong, vibrant sector, lots of creativity, have resources, can respond. But it's clear that we can't do it all. We never have claimed to do it all, but I do like starting with the conversation of this is what we are doing, this is what we know, and this is how you can help. So thank you very much.
Merci, Kevin, and it's congratulations for setting up a fund and raising $2.5 million in less than a week. And responding in real time to this emergency. I do have a couple of questions for you. One is, how did you frame the pivot for your board to emergency response and fund?
A great question, and it's interesting because we've had this conversation several times with the board before, with the wildfires in BC, with the opioid crisis, now with COVID-19. So the fact that we talked about it before, it didn't come out of the blue. So it wasn't as if it was the first time we've indicated that there's a need for us to play a role. This is so it was not so much a pivot, but more an escalation, where we said, you know, this compared to previous crises is significant. It's also important, you know, Conrad was talking about future crises. We still have an opioid crisis. That hasn't gone away. It's been overwhelmed by this conversation. But so I'd say it was less of a pivot, but more of an escalation.
Thank you. And the second question is related. How are you balancing the short-term urgencies vis-a-vis the COVID response versus the granted mid and long-term objective of continuing program development and funding requirements? And are your granting cycles continuing as planned, or are they being impacted?
Yeah, one of the first questions we asked ourselves were those that set. So for current grantees, we have told them that we're very flexible in terms of what their timelines are, what they're impacting. If they need to pause programs, you know, there's going to be no increase. We're going to really relax in terms of what we've expected. We asked ourselves, should we convert those, let charities convert those funds? And our initial sense is we'd rather create a new fund to address new needs than try and convert funds that we've already granted. So our expectation is that our current programs will probably pause in a number of organizations, and that's fine. New funds being created for emergency response. Our existing granting program, we're still running it. We have a call open now that is opened in January, is intended to deliver granting decisions in June. We think we can still do that work. Organizations are you know, working at home. They're able to describe what they want to do. They may not be able to start in June, and that's fine. We have another call that is scheduled to open in July. We don't know whether it makes sense to open that call or not. So we're or even repurpose those funds. So the second call is, I think, still we hope to be able to carry on with our underlying programs, kind of relaxed and attenuated, but we're certainly haven't made all the decisions or ruled anything out at this point.
Thank you, Kevin. We'll now move to Marcel. I'd like to talk about through the eyes of a foundation. It's got a national scope and mandate, but very much a family foundation, and with a profile that many of the people listening in would find familiar. So Marcel, what have you been up to the last week?
Alors, bonjour tout le monde. Écoutez, ma présentation va être en français, mais en anglais plutôt. Mais ça va me faire plaisir de répondre aux questions en français si c'est ce que les gens veulent. That's a great model, Kevin. Just by the way, very, you know, it's fascinating. Hope it grows across the country. I'm Marcel Ozette. I'm the CEO of the Lawson Foundation. I'm also the board chair of YMCA Canada. I say that because YMCAs, like many other nonprofits, are dealing and struggling with the issues right now, and so I'm seeing that firsthand. We're a national foundation. We've been around for over 60 years. We mostly provide larger, long-term program grants, but we also provide some very small community grants, particularly in the London area, which is where the roots of the foundation are, and that are still multi-year, but much smaller. Organizations like shelters, Meals on Wheels, food banks, youth mental health centers, etc. So that's very much part of what we do also. First thing we did, as Kevin was saying, is we, of course, are working remotely. The foundation works remotely quite a bit, but now we're entirely remote. Of course, the first thing is to make sure that staff is safe and that we can continue doing our work. So along with our colleagues at Foundation House, we are essentially working from home now. If I can look at the first slide. 5 things foundations can do. And here I'm not going to tell you things that you probably don't know. A number of foundations are already thinking about that, but it's good probably to think about it again. And just a few days ago, the Hallman Foundation identified the kinds of things that it was doing for its grantees, very similar to this, and I think that was great. First thing, I guess I would say, is the importance of ensuring continuity of payments, which sounds pretty obvious, But my understanding, particularly from a number of small organizations, they're not clear about that. They don't know the funding from the foundation is going to continue. They don't know how our endowments are doing. So that certainty piece is really key for them. So I think it's really important to remind our grantees, if we can, that payments will continue. It also means inside, though, that we have to make sure that our continuity plan is working, right? What happens if one of our staff falls sick, or a few of us? I mean, how do we ensure that those payments will actually get out? So we're also working on that to ensure that we can do a lot of that electronically, again, to give that certainty to the organizations. The second one, provide flexibility in the use of dollars. And another way of saying that would be, you know, for funders, it's time for us to get out of the way. I think, we have confidence and trust. Kevin, you were saying that just a few minutes ago about some of the organizations you'll be funding. We know these organizations, we trust them, we have confidence. They know how best to use those dollars right now. So that flexibility piece for us is really key. So the message to our grantees has been, you know, look at those dollars, look at those urgent issues, paying staff, paying the rent, keeping the lights on. Those are the things that we hope you'll be able to do by us providing you that flexibility. So essentially the funds that you're receiving are entirely unrestricted. That leads to the third one, which is about pushing out reporting requirements. And I think at this point in time, the last thing that organizations are thinking about is when will we find the time to sit down and write the report and find the data and do the analysis to be able to show the kind of progress that we want to show. So this is something we're saying, listen, don't worry about that. I think our foundations could do that at this point. We'll circle back when things start to, hopefully, as Claire says, this may be much longer than we expect, but hopefully when things start to come back to the normal, we can circle back, look at, you know, what's been done. But for the time being, we're telling our organizations, we trust you, we have confidence in what you have to do and what you need to do. So just don't worry about that for the time being. Advanced payments. For a number of us who are giving multi-year funding, I think advanced payments is something that can be relatively easy to do. An example, we have a number of organizations that will be receiving, from a call that we did recently, will be receiving their second payment in June. We will be telling them that those payments will be coming up now rather than June, so that they can start using those dollars for their most urgent issues. It won't happen in every case, but we think that we can do a lot of that. Our endowment is strong enough that it allows us to do that. And we think that that's going to make a big difference. The last one, Ray, maybe, which I haven't noted here, which will be, in some cases, additional emergency funding. It's a bit like what Kevin is describing in Vancouver. There are a number of organizations that are dealing with issues that are absolutely crucial on the ground and that need to be addressed, not today and tomorrow morning. And I'm thinking here more of the smaller community grants that are really at the coalface of a lot of the problems that we've been talking about. So how can we get some additional dollars? And this is a conversation we're going to have with our board. How can we get some of those additional dollars to those organizations as soon as we can? And finally, what we did yesterday is send off a note to all of our grantees, essentially going back to what I was saying, giving them certainty around the continuity of payments, around the flexibility and the unrestricted dollars, about pushing out the reports, and also telling them, you know, we may not have thought about everything, so do reach out to us. If you look at this, the grantee perception survey, which you have on the slide in front of you right now, this is a project that Lawson undertook last year along with our colleagues at Foundation House, the Counseling Foundation, and Laidlaw Foundation. We went out to all of our grantees with one of our colleague organizations, Groundbook, which is a social enterprise working with foundations, as a third party to actually consult and talk to our grantees and ask them what they thought about how we did our work, what were the issues that we needed to address to make it easier for them to do their own work, to access the funding, etc. And one thing that came out, I think it's certainly for Lawson, that came out of that particular survey, and it surprised us, is that grantees were telling us, we want to hear from you more. We want to be better connected. And why I say that surprised us is that we've always been really concerned, or not concerned, but careful about not being in the face of our grantees, letting them do their work, right? And not putting any more onerous work on their shoulders. But they've actually been telling us that they want to connect with us more than they have in the past. So this is the time I'm suggesting that we need to be listening. And if I have one recommendation for all of us is to say that this is time for us to listen to our grantees and look at the ways that we can help them. I'm going to stop there, Jean-Marc.
Merci beaucoup, Marcel. I do have a couple of questions for you that come through. One is, and I think you've partly answered it, but let me ask the question anyway. How are you handling organizations that are canceling their projects for which the foundation has granted financial support?
Well, if they're canceling their project at this point, it's because they have no choice, clearly, right? Because they want to reach those outcomes. So the foundation will sit down with them and look at how we can work with them going forward. We're certainly not going to take those dollars back. We're going to sit down at the first opportunity where hopefully when the crisis is a bit less acute, and look at how we can work with them to get them back on track if that's what they want to do. So that'll be really a conversation on a case-by-case basis, but I think, Jean-Marc, that will actually happen.
Okay. The second question is regarding to impact investment, and you perceive as a leader in that area in the sector. Does the current situation change your approach to impact investment?
At this point, we're still looking at a few impact investments. That will be a conversation with the board and with our impact investment committee and our investment committee. We've seen from the very beginning, we've looked at impact investment as a complementary tool to our granting and our convenings. So I think we'll continue to see it as something very important. There's no doubt about that. And I would say that in most of our impact investments, the returns are quite good. So I don't see at this point any change going down that route. We have identified it as a key tool for us. We say complementary tool that's really important for charities and nonprofits.
Okay, merci Marcel. I'd like to invite all those who are listening in to continue sending your question through the chat box. We will have this open Q&A right after. I'm going to make a short presentation. But feel free to address a question to any of the panelists, and then I will offer a chance to all the panelists to react to one another and to say a few closing words. So over to me. So in terms of what is PFC up to in terms of responding to this crisis, they are three pillars of I believe is going to be our response to COVID-19. One is around advocacy. That kind of a reminder to the community, with the broader public and the government, that we're here, that we're already acting, that we want to be part of amplifying solutions, but I think that message is quite warranted at this point. I'm in contact with other national umbrella organizations to see how if we can get joint messaging around that, and people seem to be willing to collaborate. And as part of the advocacy piece, especially with the federal government, but the province have also an important role to play, as Conrad mentioned, is that we need to stretch the current CRA rules to do some of the emergency response activity. I'm thinking in particular to support to non-qualified donees, to some of the ability of the requirements to put direction and control on charitable organization for some of these relationships, and to look at other types of arrangements that are much more flexible. So to change the rules as required, stretch the existing rules as needed, and whether or not there's a need for new national, new platforms for government and philanthropic sectors to collaborate to meet the needs of frontline agencies. We've got the case of what's happening already in Vancouver. I'm hearing some feedback that there's something in Toronto is in the works. But there might be some mechanism at a national level that are required. There's a rough number floating around from someone who knows the sector quite well, that they might be cash flow needs of frontline agencies. Most of them do not have reserve, and the CR makes it difficult for them to keep large reserve. There's anywhere from $500 million to $1 billion will be required over the next 6 to 12 weeks to support their ability to maintain payroll and continue the activity, given that their fundraising activities and other earned source of income are quickly disappearing. So there might be a piece to move very quickly to create platform for the community to be able to respond to, over and above your ongoing relationship with the grantees and the way that Marcel played it out. So the second pillar is on the information sharing and coordination. The PFC will be issuing weekly COVID digests to its members, but we'll make it widely available to the funder community in terms of what's happening both at the national and local level, and to encourage people to share their response and to make that as a kind of peer learning mechanism for the community. And looking at, we support several affinity groups, and whether or not there's an appetite for some of these affinity groups to become more operational during the phase of this crisis, and early childhood, mental health, and look at pool funding mechanisms. So we'll be in discussion with the respective affinity group to test the appetite and see what kind of support structure is required to do so. And the last piece is on the ongoing capacity building. PFC is suspending all of its face-to-face training for the time being, obviously, until June 1st in our case, but also looking at what was in the pipeline and shifting to kind of COVID response. For example, looking at a webinar specifically about support to non-qualified donees, looking at a webinar on PRIs, and what's happening to on the investment side as well, and we'll do that on our own, but also in discussion with CFC and AFCs, that whoever's got the access to the proper expertise to deliver these webinars, to make that open to the broader community. So it's in terms of what PFC is the space that PFC is hoping to fill in on behalf of the members over the duration of the crisis. And the point is that several of you the panelists have made it. This is something that's going to last for several months, and we have to think both at the emergency response and the recovery stage of this emergency. We don't know, we still don't know, and we won't know for some time how it's going to play out. But it's to think through of the full cycle of an emergency response, and to be present at every stage. Next slide, please, and I'll open it up for the Q&A. Is that and these are points that have been made by some of the other panelists as well, is that it is an opportunity to be innovative. That even in my initial conversation with government, I sense an appetite to do things differently and do them quickly. I think we're going to find that also with our grantees, with different levels of government, with the corporate sector, to not to be shy to propose ideas that a week ago would seem crazy, and not all of them would work, but that it's if the normal rules don't apply in this current situation, we'll achieve a new normal over time. But there's an opportunity there to apply imagination to problems that we've never faced together before. Having said that, I mean, we do have the experience of what happened in 2008, 2009. For those of you that were involved either in the SAR response, we do have a few foundation that got the survived work overseas under the Ebola crisis. This some of that experience could be applied, but the scale is so different that we're truly entering into uncharted territories. And we do have unique strengths to bring to this, ability to move quickly. We're still sitting on significant amount of capital, but looking at the granting side, the investment side, to see how deep we can dig, and the point Kevin was making in terms of that there might be some buffers that we need to that members could look at in terms of the management of their own endowments. That it is a moment, at this point, around risk for us to step up. Private philanthropy is tax supported, and as you know, there's been criticism in the recent past that the sector is not doing quite enough. But this is a chance to demonstrate that we are incontournable part of I don't know the word in English right now, escapes me, but as part of the ecosystem of responding, that we are very much present, and we want to be part of shaping the solution and be able to move very quickly. So I'll stop here, and I'll see if we have any other questions to the panelists, and then I'll ask the panelists to talk to one another. People, from what I've seen from the panel, I don't see any current questions, unless I'm. Okay, oh, sorry, I'm told I have to check my WhatsApp. That's a question from, so does PFC have plans to advocate for income supplementation for charitable workers, stipend for charitable businesses like the for-profit sector is receiving? There are 2 million charitable workers in Canada who will be impacted. So today, as some of you know, the federal government has announced a package of $82 billion. I've been on calls all morning, so I've not had an opportunity to read in detail the announcement. I'm told they are language that's relevant for the not-for-profit sector. There is a call that from Imagine Canada from last week to the federal government to that whatever program is being put in place for small businesses on the income support side, and that these are also available for the not-for-profit sector. But it's because we don't have a natural home in government, it is always a risk that in the midst of this crisis, the not-for-profit sector is forgotten. But I do sense that at least when we do get people's attention, that they're willing to respond. But obviously, we need to look at what's being announced today in more detail, and work with Imagine and others to make sure that these mechanisms are available for the frontline workers of our organization, the charitable organization that we support collectively. Okay, there's more question coming in, so un instant. So I would like the opportunity to learn what others are doing and how we can have a greater impact as a group. Can we put small groups together around particular issues, i.e. food banks, shelters, indigenous communities, etc.? So maybe Conrad, can I ask you to answer that question and see if the other panelists want to address it as well? Conrad, you're on mute.
Am I on now? Can you hear me? Can you hear me?
Yes, we do.
All right. No, can I answer something else? Just I had a couple of points just to follow up. in the exchange, Jean-Marc? Is that okay?
Yes.
Sorry. Okay, no, I just want to react to some of the points. I think your last point is important. And I was thinking of Kevin in terms of the work with small businesses and so on. I think the first point is looking at the whole package of what the government is proposing. I have in front of me actually the charitable sectors will be, a subsidy will be available for the next 90 days, which could be a maximum of $1,300 per employee and $25,000 for organizations. These are small organizations. So we're seeing a number of government packages coming in. And so, I'm hearing a lot on the immediate subsidy in terms of immediate needs of organizations. So we're going to see some relief that's going to take a little bit of time. So how do we help organizations with that? And again, I think there's a larger package for the nonprofit sector that we need to work on. I think I just wanted to, just again, and I said it earlier, but as we see the events develop, as we see the number of cases increase, the issues that were raised first in terms of protection, how do we work in that environment of both? And I think Claire talked about that, of keeping contact and keeping people protected. And the training and the materials to do that, it's not business as usual. And we're not quite in that understanding what that means right now, because especially when we're going to talk about a lot of these vulnerable populations, you can't expose them at the same time to risks or your volunteers. And we're going to be in a context where volunteers or staff are not going to want to work unless they're protected. So I think we need to, I can't answer all those questions, but this is a big part of what's coming as well on how we better prepare, because I'm still sensing sometimes a sense of business as usual in this. It's not a natural disaster response, as we know, because there's other aspects. So my only point, I think, in reaction again, is I think there's some immediate short-term needs that organizations that are here can help. There's going to be some there's going to be a lot of alleviation of financial needs with the governments, and there's going to be long-term needs after that. So how do we manage that? And I think with Jean-Marc, I think certainly how we share all this information and have one front in terms of talking to government about the needs. And yes, coordinating on the most important needs. I think we're getting inundated right now by calls from many organizations on how we can collaborate, how can we work together, how we can share things. And we're definitely in that space. We're just trying to manage the demand right now and understand what's our unique contribution, the Red Cross in this compared to others. And certainly I've mentioned whether that be the space in terms of training people in terms of protective equipment could be one of the areas that's going to be needed, but there may be others. But I think we're very open to this communication sharing as we get forward and as we organize ourselves as well.
Merci, Conrad. Can I invite the other panelists to react to what Conrad just said?
Jean-Marc, I've a couple of things that occurred to me in relation to what Conrad was saying. I also really like the drawing our attention to the fact that there will be disasters upcoming. I think that's really important that we think of the things that might come that we've seen in the past, likely to expect in the future. But also, just wanted to repeat a little bit about what I was talking about, the opioid crisis. We're actually there are existing crises that are continuing and not abating. And in fact, the COVID crisis makes them worse. One of the main ways that we've been dealing with opioid use in BC is encouraging people to use, don't use alone. You know, go to safe injection sites, be with other people, yet the messaging around COVID-19 is the exact opposite. You know, stay isolated, stay alone. So we have to understand how these crises that are very different solutions, but they actually it might be exacerbating and amplifying the negative effect of each one. And secondly, again, we need to look a lot more closely at the federal supports, but a lot of them, as I understand them at the moment, is they're helping people that are already in the system. You know, GST rebates, child welfare benefits. We've learned in our work with people most affected by poverty, they're usually outside the system. They're ones who don't have the disability tax credit. They're ones who don't even file their taxes. And so I would encourage all of us to look very closely at, and this should be the expertise that we have as the philanthropic sector, very ground community-based, is identify those for whom these benefits will not reach. Do whatever you can to help those systems extend their reach into populations that are currently excluded, but always remember that these crises tend to exacerbate inequality, and we should really be paying attention to trying to find those that are not being captured by these extraordinary supports.
Marcel, thank you.
Simplement pour ajouter, building, I guess, on what Conrad and Kevin were saying, that we're going to see huge challenges coming forward. This is not the last one. We're probably in a very new world than we used to be. And I know this sounds a bit cliche, but we've been talking for a long time now about foundations collaborating more. I think we're starting to do that. But the example that Kevin has given about Vancouver, I think this is going to need to be stimulus for us in terms of how we're going to need to collaborate in a small geography, but at a national level. But we're going to have to work together as foundations, I think, much more effectively going forward if we're going to try to address these huge problems. Sounds cliche, but hopefully it's a reminder that this continues to be important.
Good point, Marcel. Claire, please.
Yeah, so a couple weeks ago, I had the chance to facilitate a panel discussion with some foundations based in Detroit who were involved in the grand bargain that bailed Detroit out of bankruptcy in a very short time frame. They managed to mobilize something on the order of $300 million to bail the city out. And one of the main lessons from them is exactly that, is collaboration. In terms of how they, mobilize their boards, all of, their community foundations, private foundations, national foundations, local foundations. They created a committee with executive directors and chairs of the boards to discuss, to exchange ideas. And then each of these foundations then went back to their own boards to make sure that, every board has different ways of functioning, but they managed to mobilize significant funds from foundations that, are art focused or health focused, or have all kinds of diverse mandates and missions in response to a very clear crisis in their own community, without which we don't know where Detroit would be today. So I see this COVID crisis as an international crisis, of that scale, where each of us have our own missions and priorities. And I think that it's on us to step up to the plate in a very big way, with as much flexibility and compassion as possible, to address this crisis.
Thank you, Claire. Now the questions are coming fast and furious. We won't be able to get to all of them, but we will share them to the panelists, and hopefully we can send some point notes to continue the conversation. But I do have one question about, again, it's a bit related to what Claire just said about board making decision. And our board makes decision formally in the context of board meetings. How is the Lawson Foundation so nimble and able to respond so quickly to changing needs? I think that's applied to all of the panelists today.
So maybe if I can answer, if I talk about the things that we're doing right now, they are essentially variations or extensions of what we already do. So that's one element. So advance payments are things that we do now and then when we feel it's necessary. The foundation has always had a philosophy and approach of flexibility with its grantees, so that makes it relatively easy. In 2008, the foundation, like a number of other private foundations, had decided not to draw back, despite the fact that the market had been so that the foundation and the board recognized that this was the time to be there for community, not actually to retrench. And just on a very operational piece, I'm in contact with my board on a weekly basis, every Friday. So I've been working, talking about this with my board for the last 3 weeks, probably. So it allowed us to move quite quickly. But essentially, it's because these are issues and ways of working that we've had for a long time. We're now just doing it in a much broader way than we've done more recently. So I think that would be my answer to that one. Every board, every organization works differently. but your philosophy and your approach to grant making, I think, is a big part of it.
Anybody else wants to comment? Seeing none, I'll move. We have time for one or two more questions. Donc, question en français. Je vais la lire. Depuis lundi, je suis en étroite communication avec la plupart des organisations que nous appuyons. On me partageait que les organisations ont été inondées de communications courriels par les fondations, partenaires financiers, autres organismes, réseaux d'organismes, allant jusqu'à doubler le nombre de courriels d'information. Comme le temps de chacun est précieux, cela pour moi démontre l'importance de s'assurer de bien coordonner les communications et les soutiens. Est-ce que nous pouvons aborder cela ensemble? So the question is about the people being overwhelmed by the flow of communication, and is there ways to be more efficient in sharing and responding to this overflow? Claire.
Yeah, I'm going to go ahead and basically say what my sister said in the chat. Hi, Sylvie. Which is that it might make sense to see if we can organize around issues and geographies where there may be local needs in given cities and then common needs across provinces or countries. And I really liked Kevin's model of having sort of working groups that include elected officials, for example, municipal officials, since a lot of this is going to be very local. You know, maybe we should be looking at some kind of structure to allow for that communication to not be too burdensome. For example, I imagine we've all been in touch with food banks, you know, so instead of all of us hammering the food banks constantly and them having to answer all of us separately, have sort of a centralized way to distribute the information at a local level. Just an idea.
Il est en sourdine, Jean-Marc.
Oh, so anybody else wants to comment? Marcel?
Moi, c'est pas ce que j'avais entendu. Je trouve ça super intéressant. Puis c'est quelque chose auquel c'est sûr qu'il faut songer à cette question-là. Si nos partenaires sont surmenés et puis reçoivent une surabondance de messages de notre part, c'est un vrai problème. Ça va un peu la question de la collaboration. Donc, merci de la question. La réponse n'est pas facile, mais c'est bon d'être au courant de ce sentiment-là.
Si je peux, Jean-Marc.
Vas-y, Conrad.
Oui, je pense qu'en partie, la discussion aujourd'hui, c'est de commencer à se donner une perspective des besoins immédiats, des besoins les plus essentiels, mais une perspective aussi des autres étapes qu'on peut partager, puis aussi du travail qu'on peut faire ensemble. Je pense que tout à fait un travail local en termes d'organisation. Jean-Marc, on a déjà parlé avec les fondations, les centraides, des compagnies, pour approcher ensemble le gouvernement canadien. Donc, il y a un travail commun à tous les niveaux, mais il y a une lecture commune de la situation qu'on doit partager, qui est besoin à court terme, le moyen terme et aussi le long terme pour les organisations. Puis comment on va coordonner effectivement.
Merci. Peux-tu répéter, faire un sommaire en anglais brièvement?
Yes, I was just saying, I think I agree with what was everything was said. I think part of what we're trying to do collectively is to get a perspective of where we're going, what are the issues short term and the needs short term, mid term, and ongoing after that we can share that perspective and that we can start sharing the workload in terms of what could be done nationally. And I think I've talked to Jean-Marc already, as well as United Ways and so on, in terms of advocating on the national side, on the federal side, what we need and how we organize ourselves provincially and municipally as well. So I think but sharing a common perspective of how we see the needs and how we see the timelines, so that we're not all at the same place doing the same thing, but we're also looking at the ahead as well. And you know, because and we have to do the immediate, but we have to look at the other issues and how we're going to deal in a few months as well.
Donc, merci, Conrad. I'm going to ask, coming to the end of the call, just going to ask each of the panelists with a few closing comments. Obviously, this is the first of many calls on different platforms. Not all of them will be organized by us, but obviously I see PFC playing a role in both the gathering and dissemination of information to the different platforms, and working very closely with the Canadian Red Cross and others, and sharing both the operational and a kind of more strategic analysis that's taking place. It'll be a very fluid situation. But on that note, let me start with Marcel, and we'll go around the panel.
Very shortly, I'd get back to the collaboration piece again. From what I've heard just on this call and the recent questions from the participants is, you know, if we're going to deal with increasingly these kinds of issues, different or bigger issues, we have to find a way, and Conrad spoke to that too, we have to find a much more effective way of collaborating. And I think, you know, I think PFC can help us do that. I think the Environmental Funders Network can help us do that, Community Foundations Canada, Imagine, etc. But I would say if there's one thing that comes out for me is, let's find a way to collaborate and communicate more effectively.
Kevin?
Sure. Two examples that Toronto Foundation as well as Vantage Point here in Vancouver are establishing ongoing platforms for communication. So Vantage Point, as an example, has a CEO ED chat every day at 4 o'clock. You just log on and you'll find your peers there, and you can have a daily touch base with your peers. So there are things like that that are being created. I would encourage all of us that if we think we need to create something, just look around first and see if someone has already created it or it exists before you do it yourself. That's, you know, first instinct should be to find, is it already there? And is that information already there rather than asking for it? But second, we collectively have the opportunity to be creative. If you think you need something and it's not there, then create it, but then tell everybody about it so that you, your innovation and collaboration or your innovation and structure is broadly known.
Claire.
Sure. I mean, I think everything has been said already. I think now is the time for the philanthropic sector to step up to the plate in a big way and support our communities in this time of need.
And Conrad? Conrad, you're on mute. Yeah, yep. Sorry.
Sorry. I think one of the things as well is that this communication needs to be ongoing because the situation is going to evolve. So I think we've got a perception now, and we'll have some others. So I think this is a great opportunity. There's no way we can respond as usual to this type of event with a high level of collaboration, sharing, agility, innovation, but also ongoing communication, because we don't know how everything's going to react and how we need to adapt as well. So I think maintaining this type of ongoing collaboration and communications can be essential.
Donc, merci. I apologize for the question we didn't get to. We'll share them to the panelists. We'll try to see if we can send some points to be shared with everyone that was on this call. We will make this webinar available on our platforms. And as I mentioned, this is the first attempt to get to terms with this very fluid crisis. We are looking at all of our internal function and resources to be able to support the community to step up the plate, and for us to work even more closely with our national partners, and looking at our, as I mentioned, our affinity group and others in terms of having some thematic response in specific areas. So we'll be in touch. For all those who are already registered to our newsletter, will receive this COVID digest this week, but it's open to anyone to receive it as well. And our Twitter space, I know we probably spent too much time on Twitter, but we'll be also more active and keeping track of ongoing development through Twitter. So I encourage you to follow us on Twitter as well. So on that note, I'd like to thank all of the panelists today to make time for this, and for all those of you who follow the conversation today. So merci beaucoup et à la prochaine.